Today I will be discussing about screening and prevention of endometrial cancer. Actually, there is no high quality data which support the efficacy of screening for reducing endometrial cancer mortality even in patients on tamoxifen. However, the screening and risk reducing hysterectomy advised in patients with Lynch syndrome who carries high risk of endometrial cancer. Why not routine screening recommended in the general patients? Because 75 to 90% of these patients present with abnormal uterine bleeding, and there is no non-invasive test for endometrial cancer, which is sufficiently sensitive. But patients with Lynch syndrome have a lifetime risk of 13 to 71% of endometrial cancer compared to 3% in the general population. So these patients are especially important for screening and prevention strategies. Lynch syndrome is due to an autosomal dominant mutation in of the DNA mismatch repair genes. These individuals are at high risk of developing a variety of cancers, particularly colorectal, endometrial, or ovarian cancers. Endometrial cancer in these patients occurs at a younger age. Like normally, the chances of endometrial cancer under 40 years of age is only 5% of the total endometrial cancers. But whereas in Lynch syndrome patients, like 18% are diagnosed before the 40 years of age. For reducing the risk of endometrial cancer, if the patient has completed the childbearing, then you can go for risk reducing total hysterectomy with bilateral salpingo rather than surveillance or chemo prevention. But if patient has not completed childbearing, then yearly endometrial sampling starts at age 30 or 30 to 35 years or 5 to 10 years prior to the earliest stage of Lynch-associated cancer of any kind in the family. There is a role of chemo prevention in these patients. So estrogen and progesterone combined contraceptives reduce the risk of both endometrial and ovarian cancers, whereas progesterone-based contraceptives reduce the risk of endometrial cancer.